Hello. So I am doing an interview here with Brooke Walker. Brooke, say hello.
Hi.
Brooke is employed at Encompass Health Rehabilitation, where she is the director of PTAs, the director of the physical therapy assistants. And Brooke, her relationship to me is that she is my girlfriend. So, Brooke, introduce yourself a little bit. Tell us a little bit about yourself, your name, age, all that stuff.
All right. So my name is Brooke Walker. I am 24 years old. Like Zachary said, I am the director of physical therapist assistants. So basically, what that is I just oversee all our PTAs, which is what we call them for short. I oversee all our PTAs, help with scheduling, giving them patients, and just overseeing them, making sure everything's running smoothly. Any questions or complaints they might have in regards to therapy or patients. So I basically just oversee them and make sure everything's going smoothly with their therapy.
Okay, Brooke, and for the record, can we just get your age
24.
and your ethnicity?
I am a white female.
Okay. And what is your religion?
Christian.
Okay, gotcha. All right, so you kind of touched on it before, but what is your specific role within the organization? What are your day-to-day tasks?
So kind of what I mentioned before is I help with scheduling, so giving each therapy assistant patients and making sure that their schedule, works out throughout the day, making sure patients get the right amount of therapy time. They're required to meet a certain quota for physical therapy time in order to be billed, so I make sure that every patient is meeting that time, and I also help with scheduling and just making things run smoothly with the therapists.
Gotcha. Okay, cool. So my next question is, how large is the organization that you work for? So how many employees do you guys have there?
Encompass Health Rehabilitation Hospital, we have, I don't know the exact number, but I would say over 100. So we have our physical therapy team, which consists of physical therapists, physical therapist assistants. We've got occupational therapy, occupational therapist assistants. We've got speech therapy, so we have those employees. Then we also have nursing, which takes care of all the patients. We have caseworkers, doctors, pharmacists.
Gotcha. So you would say that it's a
very
pretty vast organization.
Yes.
Okay, gotcha. And is there any other institutes around y'all, like sister institutes, maybe different cities?
So ours is in Arlington. There are a couple more in the DFW area. I think there's one in Dallas and one in Mid-Cities, which is like 20 minutes from here.
Okay.
So there are a couple in the DFW area.
Gotcha. Okay. So, what would you say that your organization's goal or your mission is?
I would say our mission is just to provide the best care, service, and therapy for the patients that are staying with us. Our patients basically live there. It's like a hospital, so we have people there for anywhere between a week to 2 weeks is the average stay. So they're living there, so we want to just provide the best care possible, helping them rehabilitate from their injuries and making sure that once they discharge from here that they're going to the right place.
Gotcha. So I don't know if you can answer this question because of HIPAA or any discrimination laws that you might have agreed to whenever you were employed, but what would you say the demographic of patients is that you see? Is it, I'm going to just ask predominantly, is it older? Is it younger?
Ours is predominantly older patients, the
Okay.
geriatric population. We do see some in probably like your mid 40s, 50s, but primarily I'd probably say 90% of our patient population is elderly.
Gotcha. Okay. All right. So now I'm going to dive a little bit deeper into your organization and kind of like the ethics and what you think about diversity, how you see diversity within your workplace, and also the inclusiveness in your workplace. So, since you are uh, the director of the PTAs, you would say, essentially a manager. You guys just have different titles. Um, do you see any kind of, I would call it, insubordination from people that are uh, older than you, or any insubordination from males just because you are a female and in charge, I would say?
Right. Um, Specifically in my place of work, I haven't personally experienced that, thankfully. Getting there, I feel like people really kind of took me under their wing and made me feel comfortable there. I can see where maybe that could be a problem in other places, me being so young and being in charge of people that are older than me. I haven't personally felt that from any of my employees. I mean, that may be otherwise, something that I'm not seeing that's happening in their head, maybe thinking things, but personally to my face, I haven't seen anyone give me less respect because I was female or that I was young.
Do you see it maybe in nonverbal ways, any body language, or maybe eye rolls, anything like that in the office?
I wouldn't say not on a daily basis. I feel like, when you're working with people every day, sometimes you can have a clash of personalities, and when someone in charge is, telling you to do something that could maybe cause some eye rolls. But on a daily basis, no, I wouldn't say so.
Gotcha. So would you say that in your experience, uh, you've had positive relationships in respect to older employees?
Yeah, I would think so. Like I said, I feel like when I got there, because I am young, people really kind of took me in and showed me the ropes of the place, and, were happy that I was there, made me feel comfortable. So I personally have had a positive experience at my place of work, which I'm really thankful for.
Okay, so you've worked and even done some clinicals at several different um, institutions. Is that what you call them? Rehab facilities.
Yeah.
Yeah. So having done and worked in a bunch of different places, uh, do you think that you still had that same experience in other places as you did at this one?
Um, as a student, when I was a student doing my clinical experience, it was all about learning. So sometimes you do feel inferior when you're there as a student, because you don't know everything. So maybe so, and just feeling inferior, like, because I felt like I didn't know as much as, the people above me. But now, not being a student, being in my job, I feel like people respect me. So
you would just say that that was more of a self feeling more so than what people
Right.
portrayed onto you.
Right.
Okay, gotcha. All right. So if I can pick up on what you're saying, it sounds like your experiences are in the workforce, just dealing with older people at first is what we're talking about.
Mhm.
It's been good just because I'm thinking that it's a non-competitive work environment.
Right.
Just because you guys are looking to improve people's health more so than uh, I guess go further with your own career individually. Obviously, you would want to get to the highest point possible, but the ultimate goal is to take care of the patient more
Right.
so than gain status.
Right.
So I guess that would be able to create a good work environment.
Mhm.
Gotcha. So my next question to you is, in what ways has your experience been negative with respect to male employees? I know you talked about it a little bit more, but can you think of any, if at all, any situation where you had a male employee because you are a female employee that was maybe talking down to you or was looking down at you just because he felt like he was superior?
Um, it doesn't happen a lot, but I think it's something that I feel like a lot of women have experienced. Um, Men, especially older men, and me being young, kind of talking down to you, or even making jokes about you being young or female, stuff like that. I feel like that happens a lot in the workplace. Not specifically mine, but I know that happens a lot.
Do you think that could have a negative effect on your mental or even physical health?
Yeah, for sure. I think, kind of like I said back when I was a student, but even being like a new employee and being young, it can make you feel inferior, make you feel less than, or that you're not as important or as smart as someone who's talking down to you like that. So yeah, it could definitely take a toll, especially if it's something that's happening every day. It could definitely take a toll mentally and physically.
Gotcha. So tell me about some of the employees at your place of business. Or tell me about the diversity there. Like, is it surface level diversity? So do you just see a bunch of different people in terms of different colors and obviously just different ages? Or is it diverse in the sense of personalities? Do you have those people who are more just straight to the point, or do you have those people who are super outgoing and bubbly in where you're working?
So the place where I work is actually very, very diverse. We've got therapists who are every age you can think of. I'm young, I'm 24, but we've got a therapist in his 50s. We also have very different ethnicities. Like I said, I'm white, but we have therapists from Africa. We've got 2 therapists that are Vietnamese. So as far as ethnicity, we've got people from basically all over the world, ages. We've got plenty of males and female therapists, which I feel like, sometimes in the medical field you mostly see, like when it comes to nursing, you see mostly women, and then doctors, you see a lot of men. But for us, it's a pretty good mix of males and females. So I would say like that's surface level diversity, but when it comes to like personalities,
Mm-hmm.
I feel like especially in therapy you'll have a wide range of personalities. In the medical field you have some people, you have really smart people, and some that are not as social and a little quieter and more reserved and just very straight to the point. But you've also got, being in healthcare, you have people who are very outgoing and supportive because we're working with patients, and you want them to get back in good health. So you've got a very wide range, and then with that comes different personalities. You've got different beliefs, people being from all over the world, different religions that they practice. So I would say it's very diverse, surface level and also deeper.
Okay, gotcha. So in what ways? Give me. Sorry.
That's okay.
Let's see. Okay, so is there anything that has happened in the organization that has been particularly helpful or harmful with respect to, I want to say, your older patients?
I guess there's a couple of things I can think of. When you're dealing with older patients, and me being young,
Mm-hmm.
they can kind of see that as, why is this young girl, like, what does she know? How is she gonna help me? She's so young, like, what does she know? Sometimes you get that with older people that you may not. I even just looking at me, I look very young in the face. So people are like, how old are you? Are you old enough to be doing this? So you can get that working with older people sometimes.
And how do you take that?
I don't take it personally because I know I look young, but you just have to reassure them that I went through schooling, 6 years of schooling to be able to do this job, and I was trained very well, and I wouldn't have been hired if I wasn't. So you just have to educate them on that you know what you're doing.
Okay. Gotcha. So, knowing what you know now, is there anything you or your team or your organization that could be done differently in order to prevent some problems of maybe inclusiveness or diversity? I know it sounds like you've had a pretty good experience with the diversity and inclusion, but is there anything that you can think of?
I think our employees are like pretty diverse. Our patient population is very diverse, but there has been situations like recently I can think of. We had a patient who spoke, I think it was Chinese, and we needed someone to translate because we couldn't communicate with her, and we didn't have anyone to translate, and we have these virtual translators, so it's like a screen, basically a tablet in which you have a translator come on and help translate for you. So
And how like readily available are those? Is there a certain amount of tablets?
There's not a ton of them.
Okay.
So stuff like that, when you run into those situations, I think maybe having more of those available in order to be able to translate and communicate with patients, stuff like that. Just being able, communication barriers are hard, so maybe that might be one thing that I would want to change.
Gotcha. So it seems like you have a pretty diverse workplace, and it seems that way just because healthcare doesn't really discriminate. I guess every population of people, every demographic of person is gonna need physical care at some point. So having that diverse group, like you were talking about, in terms of age, as well as ethnicity, religion, and personalities, is good for you guys, because you are working with, you said, geriatric, the older patients, but in other facilities, you have athletes that are looking to get rehabilitated, or you have moms that are looking to get rehabilitated, or even young kids. So it's good to have that inclusion and diversity, so that way your patients can be represented by somebody not even that just looks like them, but also thinks like them as well. So
absolutely.
I think that's good that you are able to have that in your workplace. So
Yeah.
thank you for your time, and if there's any last things that you want to leave with us, now would be the time to let us know.
No.
All right, well, thank you for your time.
Thank you so much.